Hi, I'm with Dr. Javvad Haider, and today we're going to be talking about the BSPRM and physical medicine and rehabilitation as a society. So, thank you very much for joining me. Can you please tell me about the society and how you're outreaching to medical students to get us more involved?
The British Society of Physical and Rehabilitation Medicine, it's a society that's for PRM physicians in the UK. Our charitable objectives are around the field of rehabilitation medicine and primarily promoting education, research, and clinical standards within our specialty. And one of the focuses for this year for us has been around medical students. And we've introduced new events for medical students. So there's taster events in Sheffield at the National Rehabilitation Centre at the end of 2025. We already have about 70 odd people registered for Sheffield and about 40 odd people registered for Nottingham. So it's proving to be very popular. And we've taken this focus because medical students often don't get the exposure to rehabilitation medicine. Some of them will have never heard of it. And it's just getting the word out there, because this is a fundamental part of being a doctor and being a medic, is understanding how to get patients functioning better after a disabling condition or injury.
So, you mentioned that you've got some taster days coming up and they've proven to be quite popular. Can you go a little bit more into what's actually happening during those taster days?
So it's going to be a mishmash on a Saturday. So there's going to be some short talks. There's going to be lots of demonstrations with a lot of tech kits. So ultrasound machines, stimulators, robotics. You'll get to try everything that we as a rehab physician get to play with. But it's just to give you a flavour of what our specialty does, because a lot of people just aren't aware of this. So it'll be a whole day. People will rotate through different stations and different sessions, and you'll be introduced to all the subspecialty areas in rehabilitation medicine all in one day. A big ask, but hopefully it will be quite inspiring.
Well, let's end on one final message that you have for all medical students who might be thinking about rehabilitation medicine as a potential specialty. What is your message to them?
I think we are at a critical juncture for rehabilitation medicine. We are expanding and growing beyond belief here in the UK. With the National Rehabilitation Centre that's coming online, with the expansion of training numbers, we will be, the first time in a very, very long time in our history, we'll be oversubscribed for our training numbers. This is the time to get into rehabilitation medicine. And clearly the interest is there. We've had record numbers of submissions to medic students for the essay prize, from posters. We've actually put one of them as a keynote speaker for this conference. The time is now, and I think if medical students know what we do and are exposed to what we do, I think the interest will be there. I think the responsibility is on us to engage medical students more.
Well, thank you very much for having a chat with me and sharing your message with the rest of the medical student community and the world.
Thank you, Nafi.
Thank you.